Properties of set amalgam. The first property that we'll discuss is micro leakage. There can be penetration of fluid and debris around the margins of cavity, which may cause secondary caries. Now, the set amalgam shows an exceptional clinical performance because of its tendency to minimize marginal leakage. Now, how does it do that? Amalgam shows a self-sealing property. Now, what really happens during self-sealing is there is formation of corrosion products in the interface. Formation of corrosion products in the interface. This seals the interface. Thus, it reduces leakage. However, this process of self-sealing is quite slow with high copper alloys. Initial leakage can be decreased using a varnish over the cavity walls or by using dentine bonding agent. Now, the second property we'll discuss about is dimensional change. Excessive contraction. It leads to micro leakage. The excessive expansion protects the pulp from post-operative pain. Now, why does this excessive contraction actually takes place? What are the theories behind this? Now, when the contraction takes place when the alloy is mixed with mercury, what we see is the contraction results initially because the particles that dissolve, and now see, when the alloy and mercury are mixed, what we'll see is the particles will dissolve and will lead to the formation of gamma 1 phase. Now, these gamma 1 phase particles, they have a tendency that their volume is quite less than the volume of gamma phase, due to which contraction is seen. Contraction will occur as long as gamma 1 phase particles are being formed. Now, why is expansion observed? In older amalgam we observe expansion, and in newer amalgam we see contraction. Now the gamma 1 particles, as they grow, gamma 1 particles as they grow, they impinge to each other. During this, they produce an outward pressure which opposes contraction. Now, if there is sufficient mercury, then it will provide a plastic matrix and expansion will occur when gamma 1 particles impinge to each other. But after the gamma 1 matrix, if it becomes hard, then the growth will stop of gamma 1, so the expansion will also not occur. The expansion will not occur. Now, what are the factors which lead to expansion or which affect? If there is a low Hg to alloy ratio, size of particles, high condensation pressure. Coming on to the third property, which is the effect of moisture. Effect of moisture. Delayed expansion. Now, it can occur in a low copper as well as a high copper alloy. So, but it should be zinc containing. Zinc containing, low copper or high copper alloy, if contaminated with moisture during trituration and condensation, will show larger expansion. It starts after 3 to 5 days. What actually happens is Zn plus H2O gives us ZnO plus H2. This gas is responsible because it collects within restoration. It extremely increases, like it causes an extreme increase in the internal pressure and expansion. It even causes the protrusion of restoration. Increases creep, micro leakage. It also leads to dental pain, also causes recurrence of caries, as well as fractures the restoration.